1.07 crore people globally in 2024. The disease burden remains concentrated in 30 high-burden countries, with India accounting for the highest share at 25%, followed by Indonesia, the Philippines, China, Pakistan, Nigeria, the Democratic Republic of Congo, and Bangladesh. Despite some progress, global challenges such as inadequate funding and inequitable access to care threaten to reverse recent gains. For India, the report presents a mixed picture. On one hand, India continues to have the largest number of TB cases in the world. On the other, TB incidence in the country has declined by 21%, from 237 per lakh population in 2015 to 187 per lakh in 2024, which is nearly double the global rate of decline. The Health Ministry has highlighted that India's TB coverage has increased to 92%, placing the country ahead of other high-burden nations. It currently has the highest number of TB cases, followed by Maharashtra, Bihar, and Delhi, however, has the highest infection prevalence rate. Despite progress, India has missed its ambitious target of eliminating TB by 2025, 5 years ahead of the global goal. Several hurdles continue to impede elimination efforts. These include a significant burden of drug-resistant TB, gaps in rural healthcare infrastructure, socioeconomic inequalities affecting diagnosis and treatment access, and social stigma surrounding the disease. Concerns over stockouts of essential TB drugs in several states, shortage of trained personnel, and inconsistent supply chains have further weakened the program. Studies published earlier had warned that treatment interruptions caused by drug shortages could undo hard-won gains. To accelerate progress, the government has strengthened surveillance and diagnostic capacity. India now has the largest TB laboratory network in the world, including over 9,391 rapid molecular testing facilities and 107 culture and drug susceptibility testing labs. More than 500 AI-enabled portable chest X-ray units are being used for quicker screening, with another 1,500 on the way. Services have been decentralized through 1.78 lakh Ayushman Arogya Mandirs. Nutritional support for patients under the Nikashe Poshan Yojana has been doubled from 500 rupees to 1,000 rupees per month. ASHA workers have been trained to identify early signs and support treatment adherence. Globally, the fight against TB has seen modest progress, with incidence and deaths declining by 2% and 3% respectively between 2023 and 2024. However, funding remains a major constraint. Only $5.9 billion was available for TB care in 2024, far below the $22 billion required annually. Research funding is similarly inadequate. Despite this, innovation continues. 63 diagnostic tools, 29 drugs, and 18 vaccine candidates are under development.